Lovely. Okay, so welcome everybody today. A few housekeeping notes before we begin. The meeting has been set up as a webinar, so you will be able to submit questions via the question and answer note, which is a function which is on the Zoom. And we will be attempting to answer some of those questions later on. Just to say that there is a web page which has the copy of the publication on the UKBIF website, and there is also a link to the petition there which we will be asking people to sign. So please keep an eye on that webpage and also on our social media channels as well, and we'll be able to update you on these things. We will be providing a translation of the document, and that is underway at the moment, and we should be available by next week. So just a little bit of background on the publication that we're launching today. As many of you know, in 2018, the All-Party Parliamentary Group for Acquired Brain Injury published its report on acquired brain injury and neurorehabilitation. And this report outlined the state of affairs in 5 key areas and gave recommendations for policy changes in health and social care, criminal justice, education, sport and welfare. And these outlines were given with the premise that if those changes were made, then life would be significantly improved for people with acquired brain injuries. So throughout the 2018 report, this was focusing on England and Wales, but it was identified that the unique socio-cultural landscape of Wales really warranted a separate approach and a specific focus. And so that's what's led to the production of this new report. We hope that this piece of work will be as pivotal as the 2018 report, and we're really looking forward to working with the Senate and the Welsh Government alongside our clinical, academic and voluntary sector colleagues, and also those with lived experience of acquired brain injury, to improve access to care and support for people in Wales. Producing this report has been a really big job, and there are many people to thank. So first and foremost, I'd like to thank Catherine Simmons, who not only proposed this project following the experience of her son Kyle, but also ran a fundraising event to raise financial support for the project through the charity Kyle's Goal. Also would like to thank Dr. Leanne Rawlins, who researched and drafted the report and advised on the Welsh translation. I'd also like to thank the regional UKBIF groups covering Wales, so the South Wales Acquired Brain Injury Forum and the North Wales and North West Acquired Brain Injury Forum, who have helped and supported UKBIF in completing and launching the document. And also to all of our colleagues across Wales who've provided information and advice. Finally, I'd like to thank Chris Bryant, who's an MP and chair of the All-Party Parliamentary Group for Acquired Brain Injury, who's provided unwavering support and dedication to our cause, and also to Buffy Williams, who is taking the cause forward in the Welsh Government. So I'm just going to hand over to my colleague, Dr. Leanne Rawlins, who will be giving an introduction in Welsh.
Thank you, diolch Chloe. Croeso pawb I lansiad amser am newid. Mae o yn wych gweld gymaint ohonoch chi yma heddiw am beth da ni'n credu sydd yn digwyddiad bwysig I niwro a sefydlu yma yng Nghymru. Ychydig o nodiadau cadw tŷ cyn I ni ddechrau. Bydd y sesiwn yn cael ei recordio a bydd o ar gael ar sianel YouTube UKBIF. Mae'r cyfarfod hon wedi sefydlu fel webinar, ond gallwch gyflwyno cwestiynau drwy'r sesiwn holi ac ateb. Mae'r gwaith o gyfieithu'r ddogfen yn Gymraeg ar y gweill, a gobeithio'n y bydd hwn ar gael o'r wythnos nesaf. Cadwch lygad ar ein gwefan www.ukbif.org.uk/ymlaen/TFC Wales a'n sianeli social media. Yn 2018, cyhoeddodd y grŵp seneddol hollbleidiol ei adroddiad ar anafiadau i'r ymennydd a niwro a sefydlu. Mae'r adroddiad yn amlinellu yr angen am newid mewn 5 maes allweddol, a roddodd argymellion ar gyfer newidiadau mewn polisi ym maes iechyd a gofal cymdeithasol, addysg, cyfiawnder troseddol, chwaraeon a bydd daliadau lles. Os bydd y newidiadau yma yn cael eu gwblhau, bydd yn gwella bywydau pobl a anafiadau i'r ymennydd. Bod adroddiad 2018 yn canolbwyntio ar Lloegr a Cymru, Mae tirwedd ddiwylliannol a chymdeithasol unigryw Cymru yn haeddu ffocws penodol, a dyna yw y rheswm am gynhyrchu yr adroddiad newydd hwn. Gobeithio'n fod y adroddiad hwn mor ganolog ag adroddiad 2018 ac edrych yn ymlaen at weithio gyda'r Senedd a Llywodraeth Cymru ochr yn ochr â chydweithwyr yn y sector clinigol, academaidd a gwirfoddol, ac wrth gwrs a pobl sydd â phrofiad personol o anaf i'r ymennydd i wella mynediad at ofal a chymorth i bobl Cymru. Mae cynhyrchu'r adroddiad hwn wedi bod yn prosiect mawr, a mae llawer o bobl i ddiolch iddynt. Yn bennaf, diolch i Catherine Simmons, ac unigodd y prosiect yn dilyn profiad ei mab hi, Kyle. A hefyd am cefnogaeth ariannol i'r prosiect drwy'r elusen Kyle's Goal. Hoffai UKBIF hefyd diolch i fi, Dr Leanne Rawlins, am chwilodd a ddrafftiodd yr adroddiad ac am roed cyngor ar y cyfieithiad Cymraeg. Mae grwpiau rhanbarthol UKBIF yng Nghymru wedi cyfrannu at y gwaith a fforwm anafiadau i'r ymennydd De Cymru sydd wedi helpu a chefnogi UKBIF i gwblhau ac i lansio y ddogfen. A hefyd diolch i'n holl gydweithwyr a roddodd wybodaeth a chyngor. Yn olaf, diolch i Chris Bryant, aelod seneddol a chadeirydd y grŵp seneddol hollbleidiol ar gyfer anafiadau i'r ymennydd, sydd wedi rhoi cefnogaeth gyson i'r achos, ac i Buffy Williams sy'n bwrw ymlaen ar achos yn Llywodraeth Cymru. Rydym yn falch iawn bod Buffy Williams, aelod Senedd y Rhondda, wedi cytuno i'n helpu gyda'n gwaith yn y Senedd. Rydym yn gweithio ar dabl amser o ddigwyddiadau sydd yn dechrau ym mis Medi, i godi ymwybyddiaeth o'r adroddiad a gweithio tuag at yr argymhellion. Rydym yn gobeithio fydd y deiseb yn arwain a sadl ffurfiol yn y Senedd a fydd ni yn trefnu lansiad ffurfiol yr adroddiad ac yn darparu cwestiynau i'r gweinidogion. Rydym angen eich cefnogaeth i sicrhau bod yr adroddiad hwn yn cael effaith eang. Os gwelwch yn dda, ymunwch fel aelod o UKBIF i gael gwybod sut allwch chi helpu. Gallwch gael y gwybodaeth ddiweddara ar ein gwaith yma ar www.ukbif.org.uk/TFC Wales. Diolch yn fawr. Thank you very much.
Thanks very much, Leanne. That's much appreciated. So we're going to move now to share a message from Chris Bryant MP, who unfortunately couldn't be here today, but he has sent us a short film. So I'll be sharing that with you now.
Acquired brain injury is a hidden epidemic in this country. Roughly 1.4 million people across the whole of the United Kingdom are living with a brain injury that they've acquired at some point in their life, whether that's from stroke or a crash or a blow to the head of some kind or carbon monoxide poisoning, whatever. For the last few years, I've been fighting on this battle because I want to get better treatment for people. That means really good neurorehabilitation for people when they need it. I also want to see changes in the way we deal with this through the criminal justice system, in the education system, in our schools, and making sure that patients and families aren't pushed from pillar to post to try and get the support that they really, really need. Now, a lot of that has been focused here in Parliament, but we also need to make sure that everything in Wales is specifically affecting my constituents, obviously in the Rhondda, is working in exactly that same way, making sure people get the support they need in the major trauma centres, in the hospitals and from local authorities, but also making sure that all the different bits of government, the Department for Work and Pensions that provide benefits for people, the Ministry of Defence that look after people in our armed forces who might have had a brain injury, and the people dealing with prisons and people in the health service and people in their line of work. So it's really good news that following the report that we produced for the UK a few years ago, there's now going to be a specially commissioned Welsh document, which is laying out some of the really big things that we need to change. And I'm absolutely delighted that my friend, compatriot and partner in crime, Buffy Williams, the new Senate member for the Rhondda, is going to be taking this up in the Senate and with the Welsh Government.
So thanks very much to Chris for that message of support. and we're certainly looking forward to working with Buffy in the autumn. I'm going to just hand over now to Dr. Leanne Rawlins. She's going to talk about the process of putting the Welsh report together for us and how that's taken place.
Thank you, Chloe. If you could, there we go. I was just about to say if you could enable a screen share, but it's already done. So prynhawn da everyone, welcome and good afternoon. So as Chloe said, I'm Dr. Leanne Rawlins and I drafted the Amsterdam Newid Time for Change report. So I'm going to spend the next few minutes just telling you a little bit about why there is a need for a report focusing exclusively on Wales, and I'll outline the research strategy and some of the key issues and recommendations which stem from this report. But before I begin, I would like to tell you a little bit about Aeron. Aeron has now become a friend of mine. In 2013, Aeron sustained a serious traumatic brain injury in a gardening accident when a friend on a ride-on mower ran over a stone. This stone shot through the air and struck him on the side of the head. He was transferred to Stoke Hospital, which is part of the major trauma network for North Wales. He spent 3 days in intensive care, 2 days on a ward, and then was discharged back home to North Wales. Due to the accident, he had lost the ability to communicate. He could not speak. He was very confused and he had very little information about what happened and what would happen next. It was 2 weeks before he saw a GP. That GP then referred him to a speech and language therapist at a local community hospital. And it was only through that speech and language therapist that he learned about the North Wales Brain Injury Service, where he saw a psychologist 1 day a month. To this day, he still experiences extreme fatigue and migraines, difficulties with memory and concentration, and he still has difficulties with his speech. This has all had an adverse impact on his family and social life and on his mood and well-being. He states that overall, help with recovery and rehabilitation has been lacking in North Wales. Prevalence and incidence statistics specifically for Wales are hard to come by. The best stats we have are in this report. So in 2016, there was on average 46 ABI hospital admissions every day, which is the same as 1.9 per hour. So it is not a small problem. The consequences of a brain injury are typically lifelong and of course can affect all aspects of a person's life. And support after a brain injury has been identified as a substantial area of unmet need. So people with an ABI are not only trying to navigate life with a brain injury, but they have to also navigate a complex neurorehabilitation environment where there are many barriers to accessing care. And these are exacerbated in areas of socioeconomic deprivation and rurality. But of course, I don't need to tell you why you should care about brain injury in Wales. You already do, or you wouldn't be here today. So thank you. So in 2018, as you heard, the all-party parliamentary group on acquired brain injury developed their Time for Change report, focusing on these core areas in England and Wales. But a report focusing on England and Wales does not put at the centre the unique factors that are associated with the landscape of our nation that are relevant for brain injury and for support services. So Wales needs an All Wales report. So let me introduce to you the Amsterdam Newid, the report focusing on acquired brain injury across the core areas of neurorehabilitation, education, the criminal justice system, sports, the welfare benefit system, exclusively in Wales. So to conduct this report, I first reviewed the 2018 report and any progress that had been made in Wales since then. I conducted an extensive critical review of recent empirical and scientific evidence, and I reviewed as much Wales-specific literature, legislation and policy documents as I could. I liaised with health boards and with Kyle's Goal for data, and I liaised with expert colleagues and organisations to understand the current clinical and also academic landscape across all those core areas. So this report really is a product of a vast network of experts and organisations within and outside Wales, so thank you to all involved. I also spoke to a number of experts by experience, people with a lived experience of brain injury, and developed the case studies that you can see within the report. I synthesised and presented the findings, and together with all colleagues involved, we made key recommendations for change. So some of the key issues and recommendations for neurorehabilitation was that there's an urgent need to review the incidence of acquired brain injury, to ensure that existing services are appropriate, are fit for purpose, and that new services are implemented as required. Currently, there are very few specialist neurorehabilitation services in Wales and even fewer paediatric services. For North Wales, where I live, there is no inpatient unit and no specialist paediatric service. So all children, young people and adults in Wales should have access to rehabilitation and early access to inpatient rehabilitation, which is then continued into the community. But for this to happen, funding needs to be reviewed, and there needs to be better cooperation between health, social and education departments to ensure a holistic continuity of care. Currently, rehabilitation prescriptions are not given to all individuals with an acquired brain injury, especially those treated outside of a major trauma centre, and GPs do not always receive a copy, or the patients themselves. For education, there is also a need to review the incidence of ABI within the education system. There is limited knowledge of ABI among educational professionals, and these can have difficulty identifying what assessment tools are appropriate, what learning strategies and interventions might be effective. So a key recommendation is that all educational professionals should have a minimum level of awareness of acquired brain injury and its associated educational requirements. And this could be done through a short online course. Currently, there's a lack of liaison between health and education departments, and this is crucial for the key recommendation of providing individually tailored, collaborative and integrated support for someone's return to education and continuing on through their education experience. Statements of special educational need, which is a document outlining additional support, should also have consistent input from neuropsychological services. For the criminal justice system, people with acquired brain injury are overrepresented in the criminal justice system. Addressing this can result in cost savings and reduced reoffending rates. Currently, people with a brain injury in Wales are being failed by the criminal justice system. They are experiencing barriers to accessing justice. There's currently a lack of recognition of the link between acquired brain injury and an increased propensity of offending behaviour, and there is limited specialist service provision. A key recommendation is that there is a need for procedures to be reformed and training provided for all staff involved. There's also an overrepresentation of brain injury in the youth justice system, but there's no routine screening. So a key recommendation is that screening should be implemented routinely and at someone's earliest point of contact with the criminal justice system. People with brain injury in the criminal justice system present substantial complexity of need, and we can only address that complex need with effective neurorehabilitation interventions and training for staff so that they can adapt their practice as required. Moving on to sport-related traumatic brain injury. Currently, the mechanisms, assessment, diagnosis, recovery, and the long-term risks associated with sport-related TBI are not well understood. So funding for research is required so we can balance the risks with the known and clear benefits of participating in sport. There's currently low awareness of the management of sports-related concussion within education and within the community game. So an education campaign is required with support from government departments such as education, health and social, and public health. Many health professionals are not trained in the management of sports-related TBI, and there's poor coordination between sports associations about policy setting and concussion guidance and management. And finally, NHS provision is insufficient to address the clinical needs of people with sport-related TBI, and a key recommendation is that better pathways and pipelines need to be developed for the early detection, diagnosis, and effective care and follow-up. And finally, the welfare benefit system. There are a wide range of benefits available for people with a brain injury in Wales, but the system is complex, it is difficult to navigate, and it is protracted because there's a need for frequent reassessment. The welfare benefits forms are also not a good measure of ABI difficulties, such as the more hidden cognitive difficulties. A key recommendation, therefore, is that reassessment after a brain injury should only take place every 5 years. It is essential that assessors not only have an appropriate knowledge base, but also empathy for ABI, and to meet that, training is required. An ABI expert should also be on a consultation panel if and when changes to welfare are proposed. A felly, mi wna I gloi yn fanna wrth ddeud na rwan yw'r amser am newid yma yng Nghymru. Diolch yn fawr iawn am eich sylw. So I will end there by saying that now really is the time for change here in Wales. Thank you so much for your attention. Chloe, you're muted.
Sorry, done that so many times today. Thanks very much for that, Leanne. That was really interesting and informative. Much appreciated. So we're going to hand over now to Dr. Claire Williams, who is a lecturer at the University of Swansea and also a committee member of the South Wales Acquired Brain Injury Forum. And Claire's going to talk to us about the calls to action.
Thank you, Chloe. Just going to share my screen. So it's a good afternoon, everyone, and thank you for the introduction, Chloe. So I'm Dr. Claire Williams, and I'm an Associate Professor at Swansea University, and I'm absolutely delighted to be contributing to this event today, speaking on behalf of the South Wales Acquired Brain Injury Forum, as well as on behalf of our friends and colleagues from the North West and the North Wales regional groups. Now, it has been our great pleasure to have contributed to the Acquired Brain Injury and Neurorehabilitation in Wales Time for Change 2021 report. But now that the document is complete, we need to turn our attention to the painstaking process of working towards change. And to this end, I just want to take a few minutes of your time today to outline some important calls for action to facilitate our next steps. So first, as a collective, we want to ensure that appropriate provision of services and support is available for people with acquired brain injury for a sustainable and healthy Wales, but also to ensure that we can meet the goals of the Wellbeing of Future Generations Act of 2015. So consequently, we need to ensure that our collective voice is used to good effect, and that this incredible report is distributed as widely as possible across our networks. And this is where everyone in attendance today can help. So as the first call of action, we would like to ask you to disseminate the report as far and as widely as possible via your networks. So we would like you to read the report, share it, talk about it, and use it. So to help us raise awareness of the report. Now, we are such a strong community, and together we can help raise awareness of the report and, importantly, its recommendations in order to drive forward much needed change. Now, you can download a copy of the report via the UCABIF website with the web address presented here on the slide for ease of reference as well. Alternatively, you can find Time for Change Wales under the Campaigns tab on the UCABIF website as well. So as you've already heard today, the report is already available in the medium of English, and it will very shortly be made available in the medium of Welsh too, only in a matter of days. Now, our second call of action is for you to support the recommendations in the report and to help us petition the Welsh Senedd. So namely, we have organised a petition to help secure a one-off debate, which will be considered if we can collect 10,000 signatures in the next 6 months, or sooner if we are able to collect those signatures in a shorter amount of time. However, the Petitions Committee reviews all petitions received which have attracted 50 or more signatures, which we have already achieved, which is absolutely fantastic news. So on review, the Petition Committee decides what they can do to help take the petition and the call for action forward, which may include, for example, exploring the issue further, or importantly, pressing for action from the Welsh Government and other associated parties and working groups. However, to support these discussions and to really drive home the significance and the importance of the issue we are raising and the recommendations we are collectively voicing, and to maximise our chances of securing a debate, we would love to reach at least 10,000 signatures. So that is our ultimate goal. Now, details of our position are presented here, including the direct link to the petition, as well as a QR code, which you can scan with your phone cameras while you are joining us here today. So after scanning the QR code with your phone camera, you'll be directed straight to the petition to sign, and there are just a couple of details to capture, and it takes a matter of minutes to complete. So I just wanted to flag a few really important things to note about the petition. So first of all, signatures can come from both inside and outside of Wales. So you do not need to be based or resident in Wales to sign this petition. Everyone can sign and support the recommendations and the call for action. The second reminder is that once you have signed the petition, just remember to confirm your email address once you have signed, just to make sure that your signature counts. And then, of course, please disseminate the petition across your networks. So we're asking you all to disseminate it to your friends, to your families, to your colleagues, and to your neighbours, and to support the petition. So post it on Facebook, Twitter, and share on your networks. So share on your local headway groups and with survivors and their friends and family, and share it within your services and your organisations and further afield as much as you can. So again, everyone can sign this petition, and given the critical need and the importance of ensuring appropriate provision of services and support for people with acquired brain injury in Wales, we really hope that you'll join us in this really important call for action. So in sum, the first call of action is to engage with the report, disseminate it, share it, read it, use it to good effect. And then the second call of action is to support the recommendations in our report by signing and sharing as widely as possible the petition. So thank you very much for listening. And I will now pass back to Chloe to discuss our next steps.
Thanks very much, Claire. That was a really useful way of telling us how to engage further with this project. So that brings us to the end of the launch. And as we've all said, it was obviously a big job to get to this point. We're really delighted that we have this report available now. And as Claire mentioned, within a few days, we'll have a version in the Welsh language as well. So in terms of next steps, we're really pleased that Buffy Williams is going to be supporting us with our future work in the Senedd. And what we're hoping to do is to have a programme of events from the autumn onwards, which will help us to raise awareness of this report and of acquired brain injury in the Welsh Government. By signing the petition, there may be the opportunity for us also to have a debate, but we will also be putting forward questions to the ministers, and we're hoping that, COVID permitting, that we'll be able to have a launch and an event in the Senedd itself. It goes without saying that we do need your support with this report to make sure that it has the required impact. So to keep informed, we would really like you to keep an eye on the webpage which Claire has pointed and directed you towards, which is ukbif.org.uk/TFC Wales. And you may also like to become a member of UKBIF, in which case we will give you regular updates and information about how our work is progressing. So without further ado, I'll just say thank you all for attending today. Please take the time to sign the petition, and thank you all so very much. So we've got a couple of questions in the Q&A, which I think one of which has been, or some of them have been answered by Leanne. If you have any further questions, we will be available to answer those for the next few minutes.
We do have one question which is probably best directed to Leanne, which was HBI included in the data?
Thank you, Claire. Yes, I replied. Thank you to whoever asked that question. So the way the health boards code what is considered as an ABI and not, I think it's a little bit problematic. So off the top of my head, I think it was, but to be 100% sure, I would need to revisit that data. So I will do that. And if anyone wants to know, then please drop me an email on lrawlins@arden.ac.uk. And I can tell you a little bit more about what was and was not included in that health board data. We also have a question by Debbie. I'm not sure, Claire, if you might be the best person to answer this one. It's for how long post-injury should neuropsychiatric services be accessible before coming too far post-injury for availability?
Thanks. Yeah, I think I can answer this broadly, and it very much fits, I think, what we're all trying to drive forward as change, which is that everyone with an acquired brain injury has access to the support and the services that they need for as long as they need them post-injury. But of course, that really is the sentiment behind us driving forward the change and seeking a debate so we can secure better services for everyone.
Thanks, Claire. There's one question that has just come up, which is asking whether the presentation will be available for future viewing. So just to confirm that we will be, we have recorded this session as a webinar and we will be posting that on the UKBIF YouTube site. And that will include the presentation from Leanne and also Claire's presentation.
And Chloe, this might be one for yourself. So Mike Hope is asking, how will the recommendations for benefits in the DWP be taken forward in Wales, given that the DWP is a UK-wide organisation? So just perhaps maybe we can align that with some of our future ambitions for how we are generally driving forward the report and recommendations.
Sure. So obviously we will be continuing our work in Westminster, and we have some contact with the DWP, and obviously that work covers both England and Wales and is not separated as such at Westminster, but we will also be discussing the issues that come up specifically in Wales with the relevant ministers there. So the next question that's come up is about paediatric neuropsychology from Catherine, who wants to raise the concern that there's no access to paediatric neuropsychology for any children across Wales, and a model has been proposed. Leanne, is that something that you could answer?
Yes, so there is a model currently which shares resources with England. There is the Noah's Ark paediatric service down in Cardiff. I think they only have 4 ABI beds there. So improving access to paediatric care and support is one of the most important things that we'll be pushing forward with this report. There are no paediatric services in North Wales whatsoever. So yes, I certainly agree with you there. That is a big area of concern.
Thanks, Leanne. Okay, well, thank you so much, everybody, for coming. There's no further questions, but we will also be available to answer questions via email. If you wanted to put something forward to info@ukbif.org.uk, we'd be happy to answer your questions there. Just like to thank our panelists, Leanne and also Claire, and also the others who've been working really hard in the background to make sure that this launch is a success today. So those people are Carrie Sowden-Taylor and also Julie Smith, and also Catherine Simmons and Gerard Anderson from the Child Brain Injury Trust. So I hope I haven't forgotten anyone, but thank you everybody for attending, and do drop into the Time for Change Wales webpage to keep updated with our progress.